the mask guidance.
Asking to wear a mask.
The talk of the town is if you should be able to see your lips. With so many people debating mask mandates, you've got questions. Dig Into It has you covered. An infectious disease expert shares 3 guidelines for when you should and should not wear a mask. And this birthday candle will help you know what types of masks are actually worth wearing. Plus, what do your mask and cell phone have in common? Let's dig into it. It seems like everywhere you turn these days, there's another person calling for an end to mask mandates. The latest, North Carolina House Speaker Tim Moore. He sent out a series of tweets yesterday calling on every school district to drop their mask requirements. He's not the only one that feels that way. Last week, there were some strong feelings at the Guilford County School Board meeting calling for the district to end its masking requirements.
These masks have to go.
This mandate, it's not necessary.
The board voted to keep the mask rule, saying it was just too early to drop it. But a similar discussion is also going on nationwide. States with some of the strictest rules say they'll loosen up soon. Oregon, Delaware, Connecticut, and New Jersey all announced plans to lose their school mask mandates. And right up the road in Virginia, their governor's even expected to sign a bill banning local school districts from putting in a mask requirement. Those leaders are saying the pandemic is turning to an endemic. That means COVID would never go away, so we need to figure out how to live a more normal life with the virus as cases just hang around at a manageable level. But the U.S. Surgeon General says the pandemic is headed in that direction. He just isn't sure if we can drop the mask restriction yet.
What the general sort of view of this, I think, is that as the pandemic gets better, we should be pulling back on restrictions. The conversation now is about what should determine when that happens.
So what should determine it? We asked one of the nation's leading infectious disease experts to give us an example of when you should and should not put on your mask. Mask on, mask off. What should you do?
Wearing a mask still protects you from, it reduces your risk of acquiring COVID. And if you do have it, it reduces your risk of onward transmission.
Dr. Chris Breyer is with Johns Hopkins Bloomberg Public School of Health. He says we should pay attention to 3 fundamental factors when weighing whether to mask up. The first and most important, density and crowding, because that's what really facilitates transmission.
The second is ventilation. If you're in poorly ventilated places where you, for example, can't open windows, get air flowing. And the third is when you don't know the vaccine status of the people around you.
Doctors say some people need to be more conservative. That includes the elderly or someone who lives with an elderly person, as well as parents with children too young to be vaccinated.
If you are in a multi-generational household, or if you are in a household with anybody with immunocompromise and underlying conditions, you have to be extra cautious because those folks, even vaccinated, are still at risk of more serious disease with COVID.
And if you have COVID-19 or you've been exposed, it's recommended to wear a well-fitted mask for 10 full days around others in public or even the other people in your own house. And another reason doctors say you should keep masking up, a whole lot of red on this map. It's pretty scary when you look at it like this. Everywhere in our state remains in the critical red. That means each county falls under the CDC's highest level of transmission. In fact, more than half of the United States is in red right now. You can also go to the CDC website to check the agency's recommendations for specifically Guilford County. The site says everyone here should wear a mask indoors in public. The CDC director says she does hope to ease guidelines soon, though.
Yes, we are prepared. We are working on that guidance. We are working on, following the trends for the moment. What I will say, though, is, our hospitalizations are still high. Our death rates are still high. So as we work towards that and as we are encouraged by the current trends, we are not there yet.
Here in North Carolina, hospitalizations do remain high, but they are on the decline, dropping every day for a few weeks now. Right now, it is required for you to wear a mask in all 3 major triad cities. Greensboro, High Point fall under Guilford County's mask mandate, and Winston-Salem has its own mask requirement. Guilford County could change its rules at a meeting on Thursday. Commissioners can decide to keep, drop, or extend the requirement. Winston-Salem's Mayor Alan Joynes says the city had to hit 2 key marks before dropping theirs. The city has not reached either of those. A CBS poll found most Americans are pretty split down the middle on mask requirements. Look at this. The poll from last week saw 56% of people saying they wanted their state to have a mask requirement. Remember, North Carolina does not. It's left up to each city and county. When it comes to the classroom, 57% of parents with a child say their kid's school district should require masks. 2 years in the pandemic, doctors continue learning more about fighting the virus. The leading experts in our area, they all agree on one thing. We need to keep wearing masks. In fact, they say you should really actually invest in one of those higher grade ones, like an N95. You can see the difference when trying to blow out a birthday candle. When wearing a cloth mask, look at this experiment. This man, easily able to blow it out, but when he puts on an N95, yeah, he can't do it after several attempts of trying there.
And we look at the cloth mask, it actually provides the least amount of filtration against these all-important particles at about 26.5%.
Another doctor says the big differences come from the name. The 95 and N95 means that mask filters out 95% of the particles. He says that means if you're left with only a cloth mask, you should probably double it up to give yourself the most protection. Look, we are all ready for the day when we can put the mask behind us. The mandates will eventually get dropped, but even when that happens, masks could still be part of our daily lives, just not in the way you might expect. Listen to this. An engineer in Taiwan has started turning old disposable masks, yeah, look at that, into things like phone chargers, just technology of different kinds. He says he got the idea from seeing all the mask pollution everywhere. The disposable masks were actually made up from plastics, and that allows him to turn the mask into something brand new.
This can be a mask today. It can be completely something else tomorrow.
Another businesswoman doing the same thing. She asked all of her employees to turn in their used mask and ended up giving all of them back a phone charger. One way or another, the mask conversation, it is not going away anytime soon. And Dig Into It has got you covered with the need to know information as this debate develops. If you have more questions, let us know. We'd love to hear about them, and we'll find experts who can answer them.